You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, hot topic, stem cells for pain relief. With us, we have an expert on the topic, Dr. James Leiber. Dr. Leiber, welcome to the program.
Hi, thanks, Randy. My pleasure to be here.
Now, you have Regenexx Tampa Bay. For people that don't know Regenexx, I mean, who's the typical patient?
Well, a typical patient, Randy, there are like 40 million people in this country right now who are in chronic pain. That means somebody's had pain every day for the last 3 months. The people who tend to see us are those who have been athletic or active throughout their whole life. So we see a lot of middle-aged prior athletes or weekend warrior types. We see elderly people who like to travel, who've been athletic or active throughout their whole life, and now are in a situation where their knee or their back or something is not allowing them to do the activities they like to do.
Okay, so you are using their stem cells from their bone marrow and injecting it into the area where they have pain.
Yeah,
Is that kind of what we're talking about
you're
here?
Summing it up, that's basically what we're doing. We're using that person's own stem cells from the bone marrow, isolating it, concentrating it, that becomes the liquid that I use, and then under really precise, highly skilled image-guided techniques, placing it into the tissue that's damaged or painful or weak or unstable, and trying to get that to heal and get stronger on its own without having to do cortisone injections or narcotic medications, anti-inflammatories, surgery. This is, a really good, non-invasive, less risky, quicker recovery type of procedure. It works quite well.
When you inject the stem cells, like let's say in the knee area, is it growing ligaments, tendons? I mean, if you could give me an idea of the mechanism, like how does it work?
Yeah, so we're trying to do a lot of different things in a knee. So a lot of people coming to see me have multiple things going on at the same time. They may have some loose ligaments, they may have meniscus tissue that's degenerated or torn, they may have some cartilage that's worn away, the bone underneath may be swollen or painful. So we're trying to address the whole region, not just one structure. Okay. I think that's a problem. Some people are just trying to address a structure at a time or just randomly injecting these things into the joint. That's not at all what we're doing. We're trying to improve the region. So the stem cells injected into a tendon, for example, will help that tendon regrow or improve the quality and strength of that tissue. Same thing with a ligament. We've seen big ligament tears and tendon tears regrow back together. Other tissue, it's not going to do so much regrowing, but it might improve the quality of the tissue, strengthen the tissue, and decrease the inflammation in the long term.
So knee arthritis?
Absolutely.
Really?
Yeah, we treat it. That's probably the most common thing we treat. And we think probably 70% of all knee replacement candidates probably don't need that surgery. We have very good results with that.
Now we should mention, okay, so people need to know, look, I'm not endorsing you on the program, I'm just asking the question. It's a real interview here. But my question is, with Regenexx, I guess you guys are the leaders in this. I guess put together the protocols for stem cell. And I've, I guess, done more research, written more papers than anyone on this topic.
Yeah, there was nobody else but Regenexx for quite some time. So the two founders of Regenexx in 2005 were the first ones in the United States to ever inject orthopedic tissue with stem cells. And from that, what they did was they kind of built this field from the ground up the right way, basically tracking all their patients from the beginning, therefore looking for safety. And every time you start something new, you need to know how safe it is. So they were tracking people for that, and they were tracking people for how well this was going.
And this is called what? This is called Interventional Orthopedics. Yeah. How is what you do and how you approach the shoulder, the knee, for people just tuning in, how do you approach the sore knee, the bad knee, differently than the traditional orthopedic model?
So, let me go back a little bit. Interventional orthopedics is a concept. I think it's analogous to what's happened in cardiology. So back in the 1980s, if you had a heart issue, they needed to open your chest up to do a particular surgery. But then techniques were developed to use a catheter through blood vessels to get to the heart. And you could do all sorts of sophisticated things with a lot of finesse without ever having to cut somebody open. So that's kind of where the name came from. Orthopedics is a surgical procedure, and interventional orthopedics is using these needle-based procedures, very high-tech, under image guidance, using X-ray or live ultrasound to get needles into tissue without ever having to cut anybody. So that's where interventional orthopedics name comes from. So what we're doing is, you come to me with a problem of your shoulder, your knee, your back, you can't sit.
Even your neck or hands or anything, right?
Absolutely, anything orthopedic. So we treat all of these areas. So let's say you're at work and you can't sit there because you have sciatica, a pinched nerve in your back. Our goal is to get you back to work quickly and preserve your tissue. We don't want to cut anything out. We're not looking to sew anything. We want to get a needle into the damaged tissue, whether it's loose, damaged, inflamed, and put these orthobiologic materials, stem cells, growth factors, platelets, around that tissue or into the tissue. And really the key is the precision. We really need to get it into the tissue to strengthen it.
So the sciatica, it works on sciatica?
Works great on sciatica. I've had it myself.
Goes away?
It goes away.
Right. What about people that have had sciatica for like a year or so?
So most of the people seeing us have had whatever problem they're having for quite an extensive period of time.
Really?
Sometimes 2 years, sometimes 10 or 15 or 20 years. Your body still has the capacity to heal. It's just not doing it on its own. So we are leveling the playing field. We're taking this material that helps your body heal, concentrating it in sophisticated laboratory techniques, placing it with sophisticated injection techniques, and then your body has a chance.
We're going to take a quick break. When we come back, what to expect on day one, because you call it a same-day stem cell protocol. So we'll take a quick break. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I did a sharp turn and I heard pop, pop, pop. I had the most severe injury I'd ever experienced in my life. That is exactly when I met Regenexx. In one day, I was able to receive injections from the bottom of C1 all the way down to the top of T1. I knew that I had come to a place where I was going to be healed. 4 days later, I was actually on a Broadway stage performing. This was the best option I could possibly find for myself.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, stem cells for pain relief, low back pain, neck pain, shoulder pain, arthritis. And with us, we have an expert on the topic, Dr. James Leiber. Dr. Leiber, welcome back. So your website, just story after story, like video testimonials of one woman, 1 year, it was hard to believe, 1 year laying down, Broadway performer, and now she's back. But you say that's typical.
I mean, we have so many stories. I mean, we can't make enough testimonials to cover all the patients that we have. There's so many stories. There's a lady on our website, interesting video. She's a school teacher, just local to us in Sarasota. And she wanted to be a competitive athlete. She wanted to run. So at age 50, she decided to start running and lose a lot of weight. But her knees couldn't keep up with her desire. So she ended up having a meniscus surgery on one knee. And then she had a second meniscus surgery in that knee. And her goal, Randy, get this, her ultimate goal was that she wanted to do the Ironman. So she came to me limping into the office and said, Dr. Leiber, I would like to do an Ironman. Can you help me with that? I said, you know, even if you have perfect knees, I don't know if you can do an Ironman, but I think I can help you with your knees to feel better. So she ended up having this, what we call the same-day stem cell procedure. It took place over the course of a week, but the bone marrow procedure part of it was 1 day. And then within a few months, she was rehabilitating, and 9 months later, she actually completed that Ironman. And not only that, the following year, by the way, let me go back and tell you that she had no cartilage on the inside of her knee. She had a very, very severe case of arthritis, and meniscus was completely degenerated and torn. So with that, we did the procedure. 9 months later, she did the Ironman. Wow. The next year, she did Escape from Alcatraz, which you might be familiar with in California. Yeah. And then I think she did it again another time.
So it kind of grew new?
So it grows certain structures.
Like in her case?
In her case, it grew slivers of small amounts of cartilage, which is unheard of. But most of the time, it actually doesn't regrow cartilage. And the thing to understand, Randy, is that cartilage doesn't have any nerve endings. It doesn't actually even cause pain. It's a victim of the arthritic disease. The arthritis is releasing these substances. I think of them like solvents that are breaking down tissue. And the cartilage is then what we see as a visual indication of that. Okay. So we can still get someone substantial pain relief and obviously full function to the point where they can do a triathlon, even with outgrowing large amounts of cartilage. We make the knee more stable, we make the meniscus healthier, we can get rid of the inflammation, we can improve the quality of the cartilage that's already there. But anybody who's making claims that they can regrow large amounts of cartilage, which we're seeing people make those claims, that's fraudulent.
Now this is the confusing part, and this is why I really wanted you on the program. And that is that I guess not all stem cells are created equal. There are, like, they're calling it stem cells when they take your blood and spin it and then inject it into the area. They'll call that stem cells. Then they have these, as you taught me, these kits you can buy that are kind of dead stem cells, but there's growth factors that are injected. Then there's actually stem cells of what you're doing from the bone marrow. So could you tell me like
So I mean, where the stem
because
cells,
it is confusing us, like which one is the real stem cell?
it's important to discuss these distinctions, I think. So the stem cells in your body, where do they live? They live in high concentration in your bone marrow. So things like the back of the pelvis is a common area to find them. They live in fat tissue, and then they're kind of plastered to blood vessels in smaller quantities throughout the body. So valid sources of stem cells to get from a given person to use back in that person are bone marrow stem cells, and you can get good stem cells from fat tissue, but there's reasons why we don't want to do it though.
But isn't the problem with bone marrow, it's like a big invasive procedure?
You know, everybody thinks that, and we have that conversation at every evaluation. Everybody's like, oh, I heard this is the most painful thing you can go through.
I mean, when you hear these kind of things.
You know, the truth is, when I was working as a younger doctor in the hospitals and seeing and doing bone marrow procedures at different times, they were painful procedures, but I think it really is a technique issue. If you see exactly, we use ultrasound to see exactly where the bone is. We numb with a very thin needle using some Novocaine type of substance around the bone, and then we go back into that same spot. There's no pain, there's just pressure.
So even the downtime with that, going into their bone marrow, doesn't hurt?
No, afterwards, we give them some ice, possibly afterwards. I've had it done personally twice. I got up off the table and I walked a half a mile to go get some lunch. It was really not a big deal. Everybody says the same thing. I don't believe you, Dr. Leiber. After the procedure, they say, you know, you're right, this was what I was worried about the most, and it's really no big deal.
Okay, and so because there are clinics, and we talked about this in the green room, there's chiropractic clinics that are offering stem cell therapies, hiring like, let's say a nurse practitioner or whatever to do this, but you say it's a different kind of a stem cell.
Yeah, so most of the time, what the model that we're seeing is that these chiropractic groups are hiring a nurse practitioner or a physician's assistant. They have an MD or DO somewhere off-site who's signing off on this. Chiropractors are not allowed to inject, so they hire someone who is. They're doing these procedures, usually not at the same skill level as what we're talking about, either blindly or with minimal skill using guidance. And to make it easier for the patient and easier for the clinic, what they do is they buy these vials. They buy a vial of amniotic, we'll put it in quotes, stem cells or umbilical stem cells.
From babies.
Or placental stem cells, right. So these are legitimate products. There are a lot of these products that are out there. They have valuable components in them, but we know for sure that none of them have living stem cells in it. I mean, they have to package and sterilize these materials. We've taken it back. Regenexx has tested the products. They don't have any living stem cells. The FDA actually requires that these products do not have living stem cells, because if they did, they would have to go through the standard
like a drug. They'd be
like a drug. They three-phase clinical trials. So, but what they're doing is fraudulently claiming, this is a huge problem in our industry.
In your industry, okay.
Absolutely. They're fraudulently claiming that these products have stem cells, which allows them to kind of bump up the price. And we're seeing people charging $10,000, $20,000 for these vials. It's not appropriate.
I was surprised to hear. I mean, yours is affordable.
I mean, we use these products, but we tell patients what it is. These are growth factor products that have some value.
But they're dead stem cells.
They're no living stem cells. They may have value with your stem cells or by themselves. We think they probably do. But we charge what's appropriate based on our costs.
So you're able to go in with a scope, go into their back, or go into their bone marrow in what takes you like 15 minutes to get those stem cells out of their back?
So
half an hour?
We have certain techniques that we know get us higher quantities of stem cells. So that takes us about 30 minutes to do.
About 30 minutes?
Yeah.
And then you inject the area the same day?
So that material goes to our laboratory. We don't have a kit that spins down the bone marrow like a lot of people are doing. What we have is 2,000-pound sterile hoods with a highly trained laboratory technician under sterile environment who's creating like these individualized products. Not everybody gets the same thing. Your tissue may need different quantities or concentration of platelets and growth factors and bone marrow. And we use that to make the liquid that I then use later in that day as my injectable material. And really the key is the precision. We're using live X-ray, live ultrasound.
How soon does their pain go away? How soon what's like the best case scenario that you've heard?
So, the first few days is a recovery process. And so we kind of help people through that process. It takes them about a week or two to get back to the baseline that they started with. And then what we start to notice is somewhere around 6 to 8 weeks, we start to see a change that's happening. People tell us that they start to feel the beginning of improvement. But what's really neat about this, and completely the opposite of what you see with a cortisone injection, is that at 3 months, it's better than it was at 6 weeks. At 6 months, it's even better. And it keeps having an upward slope of improvement and seems to plateau somewhere around a year. And that becomes,
so they're back to tennis, back to golf,
that becomes their new baseline. They're back, our goal is the same as their goal. We want to find out at the day of the appointment, what is it that you want to achieve that you can't do right now? Is it tennis? Is it playing with your grandkids? Is it traveling? A lot of people retire and figure, okay, I'm going to retire and be able to travel now, but they get to a point where their hip or their knee or their ankle doesn't allow them to walk, to do the traveling. There's a lot of walking involved. So we're able to get those people to do what they want to do. That's our goal.
We should mention you. You're, an accomplished guy. 3 board certifications. Tell me about that, a little bit about your bio.
So, I came at this from a little bit of a different angle than other people. I'm not a surgeon. My specialties are pain medicine. I have a board certification in pain medicine, neuromusculoskeletal medicine, and then I started as a family physician. I still maintain that board certification. And then I have a separate certification in doing musculoskeletal ultrasound. That is, I can look at your finger or your shoulder or your knee, and I can look at that tissue real time in the office, move it around with an ultrasound, and make a diagnosis like an MRI. Actually, it's often very similar or even better than MRI.
You also worked with the Vice President and President George W. Bush. Is that right? You worked with
Yeah, I was in the Air Force for 11 years, and I had the opportunity, I was called upon by my Chief of Staff.
You went to the White House and everything?
I used to go to the White House on a regular basis, and I used to go to, I treated the President and the Vice President, the Vice President in particular for a couple of years.
Okay, good. Let's talk a little bit about arthritic knees. Let's start there with the knees. Is that one of the busiest parts of your practice?
Yeah,
knees?
Absolutely. I think knees are, somehow they were poorly designed, I guess. So a lot of people come in with knee problems, knee arthritis, meniscus problems, ACL tears are very common. A lot of it is degenerative. In other words, they didn't have like a trauma. Nobody hit them. They didn't have a car accident. They just had too many birthdays. As time goes on, the tissue gets weaker, And
especially for those like weekend active people.
Correct, yes. Somebody who's been a runner or who earlier in their life was an athlete of some sort. But other people, it just happens. Your body has a capacity to maintain balance, right? You have wear and tear and you have growth and healing. But as you get older, that balance shifts. Too much wear and tear, growth and healing is not keeping up, and you just wake up and all of a sudden that tissue is not as strong as it used to be, or is inflamed or damaged. So we see a lot of knee problems. So, basically the statistics are quite good. A lot of the people coming to see us have seen 4 or 5 orthopedic surgeons who said, "Look, it's time. Your knee the only thing you can do to help is a knee replacement." They've had cortisone injections, they've had narcotics, they've been on anti-inflammatory medications, physical therapy, acupuncture, you name it, CBD oil. There's a lot of things, cold laser. They've tried all of that, and now they're trying to avoid that knee replacement. Maybe a knee replacement is a good strategy for them. Maybe it's not. There's some serious risks.
But you've had hundreds of people that have avoided knee surgery?
Thousands, yes.
Really?
Absolutely. So that person is a knee replacement candidate. They come to see us. They want to know, is this stuff for real? And the truth is it is. The statistics are good.
Look, but if somebody's watching this, they go, but my doctor, my orthopedic surgeon said my knee's too far gone. I need a replacement. I don't think I'm a candidate for this.
We hear that all the time. They come in and say, my orthopedist said, don't do it. This is not going to work for you. Well, we have a laundry list of past patients who can tell you otherwise. Does it work on every single person? I would say the answer is no, but does it work on the majority? By far. And our statistics are the following for knees. In that situation, so we track patients. I can't overstate how important that is. Regenexx has a national registry. So every patient across the country who's getting a procedure by a Regenexx affiliated doctor is tracked by a team of professional researchers. We know how safe this procedure is, and we know what the statistics are. And so for someone like that, 90 to 95% of them at 1 year and 2 years and beyond are telling us that they've had some level of improvement. What level of improvement? On average, we're seeing in our office about 60 to 70% improvement in pain and in function. That means they're 60 to 70% better on average, even though they didn't get the knee replacement. And sometimes it's higher than that, but that's enough to get them back to playing tennis, to playing with their grandkids, to traveling, to being able to play golf, whatever it is they want to do.
Now medical doctors go to you, get this done. Like the people in the know do this.
We have so many doctors who come to see me, yes.
Okay. What about orthopedic surgeons? You ever done this?
I've had some, yes. I've had some orthopedic surgeons. I'll give you an example of a doctor who came to see me last year. She's an obstetrician, about 50 years old, and she was struggling. She was struggling in doing her job, catching babies or doing gynecological surgeries. Her shoulder was giving a problem. We did the evaluation. We found that she had an 80% tear of her rotator cuff. She saw surgeons in her hospital who told her that she needed to have a surgical procedure. But when they do the surgical procedure, they're either sewing up weak tissue or Maybe they're putting a patch in of some sort, but it's still weak tissue. When large tears have a tendency to re-tear after
The
surgery.
shoulders are tough, right? Isn't that like a very tricky thing to treat?
That's one of my favorites, actually.
Really?
I like it. Yeah. So shoulder. So she had that 80% tear. We did the procedure on her.
Did the procedure mean you took her bone marrow?
So yeah,
you harvested
it's
the
a
stem
three-part
cells.
procedure, right? But the middle part was taking the bone marrow, isolating it, concentrating it, putting it together with certain growth factors, and injecting that in and around the rotator cuff tear. But more than that, we also wanted to treat her mild arthritis. We wanted to treat her laxity or looseness in the joint. We really wanted to create a better structure, not just address that tear, because that tear happened for a reason. And then we're going to couple that with rehabilitation. That's a crucial part of this.
Okay.
They need to be rehabilitated afterwards. So we're going to combine. So the rehabilitation is going to get their biomechanics improved. Our procedure is going to get the tissue stronger. And with that,
So where'd she end up?
she's doing great. She has no
delivering
problems with the
babies?
shoulder. As a matter of fact, she came back to me for one knee, and then she came back to me for the other knee. So at this point, we've done 3 limbs, and she's doing fantastic. And she had also very severe arthritis in her
We
knee.
should mention that and we are very short on time, but in Cayman Islands, I guess Regenexx has a facility where you could actually harvest and save your stem cells. Who would want to do that?
So, they were allowed to grow the stem cells, isolate them, grow them, and store them for future use if necessary. There you can get much higher quantity of stem cells, maybe 100 to 1,000 times more individual stem cells. So there's some value to that. So
You've done that?
I have done that. I've had the procedure done myself, and I go there once a month. There's probably about 10 to 12 doctors across the country who rotate through that facility.
Patients fly there to harvest their stem cells.
Yeah, so we have varying different kinds of patients. A lot of professional athletes will go down there and have the procedure done.
So, for example, a guy 50 years old has more stem cells than if he's 80 years old, and you did the same bone marrow.
Yeah, it's not so much that you have more stem cells. You might have more stem cells. You have higher quality stem cells.
Better quality.
Yeah, better quality.
So the whole idea is to get them when you're young, in your 50s or so, earlier better, I guess. Freeze them, harvest them over there in Cayman, and then when you have a problem in your 80s, you just go there.
I mean, it's an interesting strategy. Yeah, so a lot
So
of
that's
people
what
do
they're
that.
that's what you're doing.
Absolutely, that's what we do. Yeah, so it's not to say that the procedure we do here is not effective. It really is, but there are other reasons.
This is just for the future.
It's for the future. It's if you have multiple body parts that need to be treated, you have more stem cells to be able to do that with. And for certain conditions, it actually works better than what we do here. But what we do here is quite effective.
We're going to take another quick break, and we'll talk a little bit about insurance, what's covered, what's not covered. Okay. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I don't feel like as I'm getting older that I'm going to have to give up doing what I like doing. I love running, and I love running out on Siesta Key. I love my bike. I don't mind riding 80 miles. I don't mind riding 100. My bad knee happened about 8 years ago. I tore my meniscus, went in and had surgery, and my knee has never been the same since. Anything that really engaged the knee hurt. I went to 3 orthopedics, and all 3 of them gave me the same advice, to have a knee replacement. It hurt all of the time.
She really had almost no cartilage left. Went ahead and did the Regenexx stem cell procedure. And
I went home that night and I wasn't in any pain. I had the Regenexx procedure done in February, and I was able to complete my Ironman in November of the same year. The Ironman training, I was training for 7 hours, 8 hours a day. After the Regenexx, I'm able to do everything.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, people across the country with knee problems, shoulder problems, neck problems, wrist, ankle problems are now getting stem cells injected from their bone marrow with Regenexx. With us, we have the medical director of Regenexx Tampa, Dr. Leiber. Dr. Leiber, welcome back to the program. Okay, so now for people just tuning in, so you're a very busy place. All you do is stem cell therapy, and you do it all right there, and you call it a one-day stem cell protocol. Is that right?
we call it same-day protocol,
Same day,
but
okay.
actually the same-day protocol is made up of 3 different days of treatments over the course of a week, typically.
Okay.
Right? But the middle day, so the first day is something we call prolotherapy, typically. The second day, which is a few days later, is the bone marrow procedure and the isolation of the stem cells and the placement back into the shoulder, the back, the knees. And then the third day is, we call it a fertilizer treatment, which is using a type of concentrated platelets to fertilize the stem cells that have been placed. So that's what makes up our same-day protocol.
So in your practice, arthritis condition, ACL tears, meniscus tears, just people that, I guess, traditional therapies have failed them. And now they see you guys as what, a last resort in some cases?
Oftentimes, and most of the time it is a last resort. People who are facing, for example, if they have back pain, lumbar pain, disc tears, arthritis in the back, pinched nerves, stenosis, and they're facing a fusion, for example, that surgery is, we have so many patients in this country, people in this country who've had back surgeries who still have pain and are worse off than they were before. So I've got a patient as an example. So this is a preacher actually in Florida who had back pain for about 1.5 years. He's maybe in his early 50s, really athletic guy, volleyball player. He likes to do all sorts of sports and swim and so forth. He was struggling. He really was struggling at work. He was struggling in his activities to be active. Turned out he had a pretty substantial tear in the back of his disc. And there's a lot of people who get back fusions for that. And
like a low back pain?
Like a low back pain,
okay.
But he couldn't sit. When you have that kind of a problem, you just can't sit. He's got to be standing all the time. He was struggling. So we finally ended up doing a procedure where we placed stem cells in and around the tear of the disc. And he had miraculous results. He's been a really major vocal advocate for us. He's back to playing competitive volleyball. He's back at work as a preacher, doing everything he needs to be doing. He's been great. As a matter of fact, he's come back now for a shoulder problem. He's got a labral tear in his shoulder because of all the volleyball he plays. We did that, and he's doing great with that shoulder. And then a knee problem. So people usually have multiple things going on at the same time, and we can help them with that.
Now we need to mention that Medicare, Medicaid doesn't cover this. Even the best medical insurance doesn't really cover stem cells.
Look, Randy, those insurances will pay for someone to come in for an evaluation.
Okay.
Okay. So come in for the consultation. We'll talk about whether you're a candidate. There are ways to pay for this. This is affordable.
But people finance this.
Yeah,
Is
we
that right?
absolutely. We have
finance
financing that's available for patients. As a matter of fact, now Regenexx, one big thing that they're doing is working with large self-insured companies across the country.
Okay.
We're getting Regenexx procedures covered. It's a slow process, but we have maybe about 5 million lives across the country that are covered only for the Regenexx patented protocol.
Okay, knowing you're coming on the show, talking to my neighbors, 2 of them are in pain. And I told them about the price. They go, that sounds a little bit low. But everybody would do it if they knew it was going to work. Right?
Yeah, it's about the value,
right? That's what they tell you,
It's
right?
the
They're
value.
always skeptical.
It's what's the value of being able to play with your grandkids, or what's the value of being able to get back to doing the things that you love to do, travel and playing sports or whatever it is. What's the value of that? I mean, this is an affordable procedure, and it gets you recovery quicker. It's less risky. It makes a lot of sense.
And you might as well go to us, and it doesn't cost more to go to a real center that's doing real stem cells using marrow.
We're cheaper than a lot of people who are offering fraudulent claims.
I want to thank you for coming to the program. Great stuff.
Okay.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.